2.0 project. I have a great guest with me, Dr. Andrea Sanders. I know her for a couple of years now, right?
Yeah.
So Dr. Sanders has been working with different situations. She's what is the what you talk about your profession a little bit, so I don't want to mislead anybody.
Well, that's the problem. I'm a neuropsychologist, and nobody knows what a neuropsychologist is. But basically, what we do is we study the technical definition is that we study brain behavior relationships. But nobody really understands what that means, including myself. So it's easier to say that we help people who've had some type of injury or illness or some kind of condition that affects their brain. We figure out what impact that is going to have on their day to day functioning. So, are they going to be able to continue in their job? Are they going to be able to take care of themselves? Are they going to be able to take care of their families? And then we try to help them figure out ways that they can kind of get back to their normal level of functioning, or at
So
least closer
what
to
is
their
the
normal.
injuries that really you would work with? Like what kind of different kind of injuries that is related to brain? To be a little more
Yeah,
specific, I
that's
guess.
a good question. Neuropsychologists treat all sorts of different problems with the brain. Personally, I specifically work mostly with people who have had traumatic brain injuries. So that could be anything from a mild concussion, like maybe you're at a soccer game and you had the ball and you see stars and you black out for a couple seconds, mild concussion, anywhere to a severe traumatic brain injury where somebody, maybe they were in an accident and they lost consciousness for several hours, they're in the hospital for a really long time, they're going to have a more severe brain injury. So that's what I do. But neuropsychologists also treat things like ADHD, attention disorders. They also deal with learning disorders, learning difficulties for students in school. They work with patients who have had strokes or patients who've been diagnosed with dementia. There's a whole list of possible reasons you might end up seeing a
So you work with
neuropsychologist.
different age
Uh,
ranges, right? Correct.
yeah, I I work with some children, but mostly adults. But we do see children every once in a while, just depending on what type of injury they had.
Okay. So how did you get into this field? That's actually pretty intense. Sounds intense to me.
Well, I have to admit that I had never heard of neuropsychology until I was already in graduate school. I went there thinking I was going to go to school to be a therapist.
Uh huh.
And then while I was there, I heard about this thing called neuropsychology, and I took a course, and it was about testing, because that's a huge part of what neuropsychologists do. We administer all types of tests to look at cognitive functioning. So that's like your memory and your attention, problem solving abilities, um, your ability to speak and understand when other people are speaking to you. So we do testing to assess if all of those things are working the way they're supposed to be working.
Sounds like a
And I
lot of
really
testing, though,
liked the
right?
testing.
That's a lot of testing.
It's a lot of testing, yeah, but it's a little different from therapy because in therapy, you're working one on one with somebody and you're like working towards these goals. Assessment is very kind of fact and detail oriented. You're gathering data points, you're scoring up tests, you're comparing scores to, normal levels of functioning. And it also kind of ties more in with the medical side of things. So neuropsychology, I say, is the best of both worlds because back in the day, I thought I wanted to go to medical school and work in an emergency department. And neuropsychology actually allows me to combine the medical side with the psychology side.
Oh wow. So is it you feel fulfilling?
I'm a nerd. I really, really find the brain fascinating.
That's great.
My patients always ask me, they're like, how can you do this? Aren't you bored doing this every day? But the answer is no. The brain is so fascinating. There's so much that we still don't know about the brain, and
Don't
we're
I know that?
constantly learning new things. Yeah,
Absolutely.
exactly. Our brains never cease to amaze us, and everybody is different. And so, no matter how many times I've given a particular test or I've dealt with a particular type of injury, everybody's different. And I love the challenge of putting everything together. It's like solving a puzzle almost, or doing a little detective work. You got to figure out what's going on and then look at the big picture to figure out, all right, what happened? How's it affecting the brain? And what can we do about it to help this
It
person
sounds like there's
feel
constant
better?
constant learning from your end, as much as that patient is learning. You learning the patient, and you learning whatever's out there in the new that's been, I guess, taught, learned,
Right.
or educational wise.
Absolutely. Yeah. And I absolutely do learn from every patient that comes through, no matter what type of injury they had. They never cease to surprise me. There's always something that I wasn't expecting, or something about their, maybe their medical history. Maybe they had an illness or an injury in the past that kind of affects how their more recent injury is affecting them. So I learn all the time. And in terms of the other stuff, the field is constantly coming up with new things, and we have to stay on top of the research. And I feel like there's a lot of pressure to do that because
Nah, no pressure.
things
Come on, you can
change.
do it.
Things change so rapidly, and just recommendations of what we should be doing and what we expect to happen with a particular type of injury. You got to stay on top of that stuff, so you have to keep learning.
Yeah, it seems like it's always going to be a challenge for you, and there's always some kind of change along the way. So, how do you deal with the challenge and the change that comes? Because each patient is different. He or she has different, not only injury but also personality, way of thinking, being culture wise. There's a lot of constants changing. There's no
Absolutely.
constants. There's
Yeah.
always
and
changes.
and being a psychologist, I think we like to pay attention to those things maybe more than other types of doctors do. So we spend a lot of time talking to our patients about their background and their history. So we want to know, how did you grow up? Where did you go to school? What did you study? What kind of grades did you get? What types of jobs did you have? What's your family like? Where do you live? Who's in your household? What's your medical history? We ask so many questions. We spend a lot of time getting that background information.
So when you gather all the information, because there's a lot of gathering, a lot, guys, I'm running a little close because believe me, my mic's not really working too well. So I'm sorry, guys, excuse me. But what is the when you gather everything? How's the assessment going through? Like, what is the process? Because it's got a lot of
Yeah.
information.
Well, we do that part first. We gather all that information. We interview the patient first. Then we do the testing. And like I said before, the testing is where we give all these different tasks to your brain to see how does your brain handle this task. Like there are things that your brain is really good at and things that your brain is not as good at. And we're trying to figure out what's your pattern of strengths and weaknesses in terms of your cognitive functioning. We also look at your emotional functioning. So we have to pay attention to your mood and your personality because a lot of times that can affect your cognitive functioning and how your brain is working. If you're tired or if you're depressed or if you're in chronic pain, it's going to interfere with your cognitive functioning. So we do the testing, we take the background information. And another thing we do, which I think is important, is when available, we go through people's medical records. So we get all that detailed information from when they saw the doctor or when they were in the hospital. And that gives us a really good basis of information that we can start putting all those puzzle pieces together. Because we want to form a big picture. We call it a conceptualization. But we want an idea of like, who is this person? What happened? And how has that affected their day-to-day functioning? And that's what allows us to
That's a
figure out
lot.
what can we do
That's
to get
roughly
better.
a lot of gathering and then put it into something and say, okay, this is he or she, how to deal with them. So what does the word cognitive mean? Because I sometimes people don't have all that
Yeah.
what meaning what.
It's a word that isn't in our everyday vocabulary. But when we say cognitive, we're talking about the thinking skills. That's how I explain it. So things like your memory, your attention, your concentration, your problem solving skills, all of those tasks that your brain has to do on a daily basis, those are your cognitive skills. So that's a little bit different from, say, psychological symptoms. That's depressed mood or tearfulness or maybe anxiety, worries about the future or worries about your symptoms. That's the psychological side of it. So cognitive is a little bit different. And then there's also the category of like physical functioning, and that's like your aches and your pains. I know my patients are usually dealing with things like headaches or dizziness or sleep disorders, because all of those things are very common with brain injuries.
Wow, that's a lot. That's definitely a lot. So how do you deal with your patients, or what? How do you deal with your, not with your patients, but how do you work with them for they to motivate them to to get them to the next level? Because obviously you guys started under they were here, now they're over here, and how to deal with it, because there's a lot of not only cognitive stuff, the head injury, whatever it is, but there's also emotional issues going on there, like depression, anxiety, all the stuff we spoke about before. So is just
Yeah.
it's not just cognitive. So does cognitive lead into depression, lead into sleep disorders, to lead to a bunch of other things?
Hmm. Yeah, it's all related. So your cognitive, your physical, and your emotional functioning all influence each other. So when patients come to me, they may or may not know that they're having problems with certain cognitive functions, and that's what my testing is going to find out. And so then once they're in the stage where they're ready for treatment or to start, you know, they're asking, what can I do to get better? The first thing that they need is education about what happened to them, what happened to their brain, why are they having the symptoms they're having, what symptoms are normal, what can they expect to happen, how long does this take to get better, those sorts of things. So just giving them information about their injury and what to expect is very helpful because it gives them more of a sense of control. And then the next stage, like you said, we also have to address the emotional impact of their injury or illness. So they may be depressed, they may be anxious. It's very common to have a hard time adjusting to the changes in your life that happen as a result of a brain injury. Oftentimes, you're not as independent as you used to be. So you have to depend on other people to help you with certain things. You get frustrated because you go to do something and you struggle with it and you think, I used to be able to do this. What's wrong with me? And then you start worrying about the future, thinking, am I ever going to get better? Am I going to be this way for the rest of my life? Am I ever going to be able to work again? Am I ever going to be able to drive again? So then you start getting the anxiety component. So addressing the emotional side of it is really important. It's all connected, and if you don't address the emotional side of it and you just address the cognitive symptoms, I'm not sure the person would be very well adjusted. They might not have learned how to process what happened to them and how to proceed or what to expect in terms of the
So
future.
what I'm
So we have to
hearing, I'm
treat both
sorry.
sides.
Yes, what I'm hearing is that you have to educate them,
Yep.
get them education, really explain to them what's going on, how to go about, what's going on with them and what happened and processes they may be going through, and then you got to deal with the cognitive stuff situation, and then deal with the emotional situation also, and it's all related besides the
Right.
physical aspect, whether it be headache wise, not sleeping disorders, or other physical situations. There's a lot going on
Mm-hmm.
there. I mean, it sounds very, very, very intense. So how do you motivate the patient and doing this? Like, hey, guy or girl,
Mm.
we can do this, or you're progressing. And when they're like, oh, am I really progressing? And they're trying to compare themselves, I guess, to the past. Is that the way it works? I mean, I'm just telling you out of
Yeah,
my
a lot
personal
of times.
experience, which I have traumatic brain injury also. I compared myself to the old Maurice, the Mo 2.1. This is the Mo 2.0. Guys, this is the Mo 2.0. So with the Mo 2.0, I've learned a lot. I had to learn a lot, and it was very, very, very challenging. I don't use the word hard anymore. Challenging, and you know what? And it's okay. I live up to the challenge every day. And earlier today, before speaking to you, my head was not right, and I'm like, oh, how am I gonna do this? How am I gonna do this? I can do it. I can do it. I can do it. Yeah, and I challenge myself, and I put myself out there to say, okay, I can do it. So I'm a person who deals with this on a daily basis, and today my speech seems to be okay. It's actually pretty okay. And I use the word pretty okay quite often when I'm pretty okay. When I'm not okay, I'll say it. I'm not okay, and I'm not embarrassed to say, can you repeat it again? I don't understand what you just said. Because I didn't grasp it, or you're talking too fast for me. Can you talk a little slower for me because I didn't understand what you said? Or writing things down, you have to write everything down. This is my new girlfriend, because she tells me everything. I tell her, hey, blah blah blah. I don't want to say serious because she's gonna tell me something, but I tell her everything. Remind me to do this. Remind me to do that. I have appointments. I have this and that, or I need to call this person up, or anything. If it's the simplest thing, my birthday list, my to-do list for the next day, and I do it every day. But these are the tools that I learned from all the therapists and doctors I've been to taught me, how to go through about this. It wasn't an overnight thing because I cried for the old guy. I mourned for him, and I said,
Absolutely.
why?
Yeah.
Why am I not the same guy? Why am I not the Mo 2.1? I'm better, Mo 2.0. But also,
That's a great attitude.
yeah, absolutely. You know what? And the acceptance was really, really hard for me. And so my friends say, okay, oh, you've changed, and the times they guide it, and sometimes they don't. They think I'm the old guy, and I get it. I understand it. I've accepted them also. 'Cause most people don't know what the difference is. I don't have a sign here that says traumatic brain injury. When I had my leg injury, yeah, people knew you had a leg injury because you have a cast on, you have a brace on.
Sure.
You have a neck injury, you're walking around with a neck brace, and you can visually see it. But things like traumatic brain injury, you don't see it. Concussion wise, people don't see it. It's all internal, and it's very, very hard. And without therapists like you and my other bazillion other therapists that I've done, it wouldn't have happened. I wouldn't be where I am today. And I'm being serious.
Yeah, I mean, you're absolutely right.
Yeah,
And when you talk about motivation, that's that's key. And everybody's different, so there's not a magic answer to how to motivate people. Some people come in very motivated. You were just describing how motivated and you challenge yourself every day and you said, how am I going to do this? I'm going to figure it out. And that's great. Not everybody is at that level. Some people are nowhere near that point, and they're more, they come in and they're at the stage where they're still devastated and depressed, and they need to work through the emotional side before they can even consider learning how to compensate for those cognitive problems that they may be having.
do you
But I think that's an important. Go ahead.
do you work with other therapists, like, because speech therapists, occupational therapists, physical therapists, or doctors, or how do you, or do you recommend a person, a patient, hey, I'm doing this for you, but you also need this person or that person or this group that all we to work together.
Right. Yeah, I mean, it kind of depends on the type of injury or condition that the person comes in with and who they've already seen. Um, Sometimes people come straight from, they were in the hospital and then they show up in our office. And then sometimes people come after they've already been through rehab. They've already had physical therapy or occupational therapy or maybe even speech therapy. So they've already done some of this stuff by the time they get to me. So, I have to meet people where they are and figure out what have they already done and what can we do differently. Sometimes, yeah, we'll make referrals. We'll say, hey, I think you need a neurologist because you need to talk to someone about certain medications, or this pain thing is really interfering with your cognitive functioning. We need to get a handle on the pain thing. So we need to send you to a doctor that can treat the pain. Or maybe for sleep. If you're not sleeping, we all know that our brains don't work as well if we're not sleeping, at least however many hours per night. So maybe we need to treat the sleeping disorder. Um, there's all sorts of things that can be contributing. So it does usually take a team of doctors to kind of get people back to where they, I was going to say need to be, but maybe it's get people back to where they feel like they're functioning better, because that's the ultimate goal. We want people to feel as if they're functioning better, whatever that means for them. It's going to be different for every patient.
Interesting, because I felt the same also. And I'm very hard on myself, and because I want to improve myself on a continuous basis, because I feel like if I'm not hard on myself, I'm throwing in the towel. But I don't want to. I want to also motivate myself, but I'll be able to motivate somebody else, and at least one individual in this vlog to say, hey, it can be done. I did it, you did it. This person can do it. That person can do it. And I'm not embarrassed to say I need help. I'm not embarrassed to say I don't know what I'm doing, or can you help me please, or I don't get it, or I have to be an advocate for myself. I saw a TED talk a few months ago about this two individuals who had traumatic brain injury, and then one of the phrases they said is, "You have to be an advocate for yourself. You have to be out there and put yourself out there and say, hey, I need help, or I don't understand what you just said, or I need this tool, that tool." Because it's out there. We can get help, and I'm not embarrassed to say it. And I think that people should know that, whether it be a traumatic brain injury or any other kind of disability, and or issue you may have, whether it be drinking, eating, overeating, or under drinking, or over whatever it is. That there's other ways to manage it and figure it out, but we can't do it alone. I couldn't do this on my own. I could never a million years do this on my own. So I'm grateful to everyone out there that's helped me along the ways, and it's been challenging. It's been a path I've been working on, but it's okay.
It's definitely challenging, and one of the things I think that's important to remind people about is resilience. Look at your story. You have been extremely resilient. Humans are very, very resilient creatures. They can cope with and overcome so many different things, but there's not a magic pill, there's not a magic exercise. It takes a lot of creativity and a lot of motivation and sometimes a lot of time. But I think it's important to keep that resilience in mind. Everyone can make changes, everyone can feel better. Not everyone's going to do it the same way, not everyone's going to make the same goals or need the same kinds of treatments, but it's about how you're coping. If you're coping better, even if you can't walk from here to the parking lot, if you're coping better, if you feel better about your functioning, if your life is made easier, you're going to feel better. And that's the important part. And everybody can do that to some extent.
Yeah, absolutely. I believe that we have the power to do it for ourselves, so we can help ourselves, so we can help others. I'm no good to anyone if I'm not taking care of myself. I don't need healthy exercise or do all my therapies, see my doctors I need to go see, and whatever else I need to do. I'm not any good to anyone if I don't take care of myself. It's not selfish. It's it's take care for yourself. I'm not any good to anybody if I'm not any good. You
That's
know,
right. It's like when you're on the airplane and they do the safety drill and they tell you put your own oxygen mask on
it's
first
true before you help
before
somebody
you
else.
help someone else. Yeah,
Yeah, otherwise you're gonna be not in a good position. I understand.
exactly. And plus, it's advocating for yourself. When you're taking care of yourself, you're you're fulfilling a promise to yourself. I think that's important. We have to
Wow, that's pretty
treat
good, dude.
ourselves at least as well as we treat other
That's actually
people,
really
right?
good. You have to fulfill a promise to yourself, and you know everybody out there, you gotta fulfill a promise to yourself. The promise is getting better, doing better. If it's like walking at least to the parking, like Dr. Sanders said, if at least that, or half a block, or quarter of a block, or just down the steps, or whatever, or saying, hey, I'm not gonna do this. I'm not gonna put this down because I'm not having this drink, or I'm not gonna have the extra dessert. I'm gonna have just a little bit of dessert, or you know, I'm overly healthy. I'm not enjoying my life. There's no balance in my life. You gotta have balance in your life, also, guys.
That's right.
Absolutely. You know,
That's absolutely
you
right.
gotta have a little bit of balance. And but like you said, Dr. Sanders, as long as you feel good about yourself, you know, you gotta feel good about
Yep,
yourself and your accomplishments. An accomplishment may be only half an
exactly.
inch, but half an inch is half an inch.
That's right.
Yeah,
Especially if you worked hard to achieve that half an inch,
absolutely.
and that's cause for celebration.
Yeah.
Another thing, though, that you reminded me of that I think is important is that not every day is going to be a good day.
Oh, I know that.
Sometimes we make mistakes, sometimes we have failures, and that's normal and it's okay. The key is don't let that get you off track. Don't let it derail you. Just roll with it and figure out what can I do differently
Yeah,
next time.
and out of just experience, you know, you can't let that emotion get to you, and you gotta challenge it. You can't let that emotion get to you. You can't, because it becomes emotional. Oh, I didn't do this, or I failed at this, or I didn't do that half inch like I did yesterday. All right, you did quarter of an inch, but a quarter of an inch is
That's
a
right.
lot better than doing no inches. And if you did no inches, it's okay. It's okay, but you put effort into it.
Yep.
You did your very very best at it. You know, we're not all perfect. Like like it's saying goes, to be human is to be an error, right? Is that the way it goes? To be error means human.
Yeah,
Yeah, that's it. Yeah.
it's true. And I can tell you, as a psychologist, people come in and tell me all about their lives. Nobody's perfect. Even the people you think are perfect are not perfect. So don't be too hard on yourself.
Yeah, and, that's what I need to tell myself every day, not to be hard on myself. But I'm getting there. You can get there. Everybody else can get there. But you have to be consistent. Put your time into it. Work at it. Never quit. Never quit. And if you quit, take a step back and start all over again. Not all over again, but You start with experience. You never start from
That's right.
scratch. You're starting with experience. No matter what age you're at, you're starting with some kind of experience. And now
So
you know.
learn from what
Yeah,
went
you
wrong.
learn what you
Hmm.
learn from something, and you move forward and say, okay, what did I learn from that experience? Was it good or bad? But to move it into a next level.
That's right.
You think so, doctor?
Good advice.
All right. Any other advice you have out there for us people who have situations? We're all of us, the whole world. We all have situations.
Advice for the whole world. That would take a longer session than we have. But no, I think we've hit on good topics. Just, I think the takeaway message is, um, you know, keep in mind what you're capable of, and keep things in perspective. You're doing this for yourself. It's not about other people. It's about yourself, and you have to feel good about what you're doing.
You said it. It was a great ending. It was a great ending. I want to say a couple things. I want to thank you, Dr. Sanders, for this time and opportunity to chat with you. I know we're doing a beautiful Google Meets thing or Zoom thing, wherever we're doing. Guys out there, one important things. I'm really sorry if you can't hear me well. One day I'm gonna buy a beautiful mic, and you guys are gonna be able to hear me clearly. That's getting there. One day, I will get there. I give you my word. Just like I'm giving you my word, I know we'll get better every day. My vlogging will get better too.
It's a growing process.
Absolutely, this is a growing process. The vlogging, my recovery, other people's recovery. It's a growing process. It's not an overnight thing. It's not a quick fix. You're not gonna take a pill and say, all right, I'm gonna lose 20 pounds today. It doesn't happen that way. You gotta work at it. Or I'm gonna go cycle. I'm gonna go run a marathon. Yeah, you can run a marathon, but you're not running it for another year and a half because you need to train for it. I'm gonna become a bodybuilder. Okay, great, but then take you X amount of time to be a bodybuilder, and you can be at different levels at different times when you get there. just like I was, just like I still am. I still am. Just like person who has an alcohol problem or drug issue or overweight issue. It takes time. It takes time. It's not an overnight thing. Again, Dr.
That's
Sanders.
right. And it never ends. We're constantly
Yeah,
evolving.
absolutely.
Yeah.
Absolutely. Dr. Sanders, I cannot thank you enough. And guys, I'm sorry for my with my head. Thank you so much. Appreciate it.
Thank you for having me.